Welcome back to Empowered. Thank you for joining us today. I'm with Paola Ardiles, who is the founder of Bridge for Health. What kept going on in my mind as you were talking about is there's so many gaps, and I'm wondering how you go about linking those gaps together.
And do you mean the gaps in the system?
Yeah, the system and you. Mm-hmm. You know, how do you meet?
Mm-hmm.
Yeah.
Well, the way that I think about it is that there's a lot of people that are working on improvements in the healthcare system.
Yeah.
Right. And I'm actually not working in that space.
Sure.
I'm actually working outside of the healthcare system.
Yes.
Because I think that that's where we need to be investing in order to keep people healthy in the first place, so that they don't have to go into the system.
Yeah.
And so the place that we have found where there are some gaps that we actually could make a difference is in the workplace. And the reason is because you know how there's all these initiatives right now, well, actually for the last decade, around environmental sustainability and managing risk and ensuring that, you know, we're mitigating the cost of environmental impact.
Right.
Well, the next wave is around looking at social sustainability. So how do we support the well-being of the people that work for us in our organizations? And the aspect of health there is critical. And so what we've realized is, after doing a lot of research and figuring out what are the current practices in the workplace, we realized that a lot of people were focusing their efforts on the employee wellness programs that are really focused around how do we manage people that are experiencing a health challenge, right? So how do we give them the supports, and how do we help them navigate through that? And there's a host of different options for them at that point. The issue is that we're not actually consciously designing our workplaces to support people's well-being. So we're not actually looking at how do we design, the social environments. So for example, how we collaborate in organizations, how we work in teams, even the leadership style is really, really important. So much of the stress that happens at work, we know already, the literature already tells us, is at the root of a lot of illness. Right, so our bodies are stressed, and the way that we respond is that we manifest all kinds of different illnesses, including the mental health challenges, of course, that are so prevalent right now. Right. If we go back and ask people, so what is causing you stress at work? A lot of time, it's poor management, poor leadership, overwork, too many responsibilities between family and their work-life balance. And so a lot of people are just having a really hard time coping, but the expectations keep rising, right? And with everything that's going on, in the economic environment right now, people, of course, want to hang on to their jobs, and so they will keep performing at a certain level until they get sick, right? And so what we want to do is we want to transform that conversation into thinking about, so how could we actually come together, people from across the organization or the businesses, and actually start thinking about where are some places where we could actually look for some solutions that might not be necessarily developing this new very expensive technological improvement in the workplace. Sometimes it's actually about getting people training on communication skills. Sometimes it's really simple things, but it's almost like you don't know what you don't know unless it actually is shown to you. And a lot of the times I talk to people and they say, my boss and my employer, they just invested tens of thousands of dollars in this new gym in our workplace. Nobody's using the gym. And so I asked them, so did somebody ask you what you wanted in terms of improving your own health and well-being? And they said, well, no, we haven't had, we have some informal conversations, but there hasn't been anything really asking for my input. And so then I said, okay, so if I were to ask you for your input, what would you want in order to improve your health and your well-being? And the first thing that people would say was that they want to have their stress, somehow reduced. And so when I dig in a little bit more, I said, well, what would that look like? And they'd say, well, right now I have 2 jobs because I don't have enough of a wage to actually be able to afford the healthy foods and all the other things that actually keep my family healthy. So they said to me, well, a living wage would actually support me more than the gym that I can't use, for example. So there's a lot of things that if we just could have those conversations, and I think that that's what we're really trying to do, is promote that dialogue so that people aren't having to necessarily be reactive, but can actually start planning things and actually start supporting those strategies so that we're actually supporting people to stay healthy before they have to use the other services.
Well, in terms of leadership and management that don't sort of include their employees in the way that they could, that to me sounds like it's still an old paradigm of
Absolutely.
Patriarchy or top down.
Yes.
Where what you're saying then, should that piece should also change?
Well, I think it's really hard for some types of institutions
Yes.
and organizations to shift.
Right.
I think that is happening gradually. I'm very encouraged to see a lot of that happening even here in Vancouver.
Right.
And some organizations, I think that there is definitely a role to include participation in some of those decision-making processes. I think that I come from the field of health promotion, which is one of the arms of public health. And health promotion is really about enabling people to have control over their health. So to have control over the conditions that are impacting their health, right? And if you're in a workplace and you have no control, we know that people get sick. We know that. And so, having control means having a voice, and it means being able to participate. And there's so many employee engagement initiatives that are happening in so many different workplaces, and a lot of people think that they're doing a fantastic job, but we know that there's so much more potential for people to actually use that engagement strategy and actually start thinking about how do we actually tackle this problem of workplace health issues. How do we actually come together and look for solutions together? And again, working across the organization is where you get the different types of thinking. People with different backgrounds, different experiences, being able to come together and look at a problem. And it's totally different than an HR consultant trying to look at that problem by herself or by himself.
Right.
Right? There's so much knowledge that we have to share, and that's what we're really encouraging with our process, is to really encourage that participation so that we can actually come up with new solutions that don't necessarily have to cost us a lot of money, right? And that we can actually start measuring that progress, so that when we look back 5 years from now, we say, hey, when we started doing these participatory initiatives, we actually improved in these dimensions. So we can actually measure that in the long term. So
much to learn from you and the organization. No, really. I mean, it sounds like it's quite really rich, and I look forward to seeing where you take the organization. Tell me about how your background has led you to this role.
Yeah, thank you. One thing I wanted to note about us as a 4-year experiment, right? We started as a network, volunteer-based. One of the interesting things now that we've actually launched a co-op, so now we're in a startup mode, but one of the things that is worth acknowledging is that there were 4 years of us building our social and intellectual capital. So what we did was really build on the strengths of people, and where they had, knowledge, capacity, interest, passion, right? And we're really building on that in order to, launch this co-op. So I think that that's really important, because even though I'm here, I'm the face of it today, but there are a lot of people that have been involved in volunteering and supporting for us to be able to get to this stage of the startup. And then to address your question about my background, so I came to Canada when I was 5, and we were one of the refugee families during the time of the Pinochet dictatorship. And so what's happening in the world right now, of course, is very, very close to my heart, because Canada opened its doors to my family and thousands of other Chileans at that time. And I think that there are many people like myself that are really committed to building a healthier and more just society here in Canada that are actually Chilean, and there's many, people that are working in all different realms of engineering, the arts, I mean, you name it. We're all valuable contributors to the society. And we left our country because of the political circumstances. So it wasn't necessarily our choice. In my case, I was only 5.
Right.
But I think that it's those values that were really ingrained in me as a young girl around ensuring that everybody in society was treated with dignity and with respect, and that we all had a chance to live a healthy and happy life. I think that, even though there might be differences in terms of our biology or our family history, I think that that's something that has really influenced me in terms of, wanting to create a society where we all have the opportunity to achieve that health potential. We all carry different baggage and different things that happen along the way, but I think that giving people the opportunity to achieve that is really, really important. And the other thing that I want to note about my background is that we in Chile were also colonized by the Europeans, and so we have a very mixed race in terms of the Spanish, Portuguese, and indigenous cultures. And in my case, I also have roots from the northern part of Chile, which used to be part of Bolivia, where there were African slaves that were working in the mines. And many, many, centuries ago. So I have all of these kind of, different ethnicities and that make up who I am. And one thing that I've realized as I've been working on the development of Bridge for Health is a lot of those core values that we have about, wellness and creating a society that is really based on this principle of reciprocity, is something that I now am starting to really acknowledge that does come from my Indigenous roots. So it is interesting because I never actually identified with being Indigenous when I used to live in Ontario. I never identified because I always identified myself as being, an immigrant woman, right, who came as a refugee, and that whole story that I had created. When I got to BC, a lot of people thought that I was from a First Nations community here, and started having conversations with me. And then that kind of woke me up to say, hey, actually, yes, I do have those Indigenous roots, but from the First Nations people of the South. Right. And recognizing that, colonialism has also divided the Indigenous people from the North and the South. And so part of what we're doing with Bridge for Health is actually building bridges between some First Nations community in Chile, Ontario, and BC. And we're working on some health literacy initiatives and arts, promoting arts and that kind of work, because we feel like it's really, really important to not only support other nations that are dealing with the same issues as we are here in Canada, right? Around racism and discrimination and the long impacts of colonizations that has to our everyday society. And so we're trying to use the arts as a healing tool. And so that's one of the initiatives that we're also working on.
Wow.
Yeah.
That's a whole other show.
That's a whole other show.
Well, I do appreciate you being here today and taking the time to educate me and the audience. So it's been wonderful having you. And thank you so much for doing this work and for helping humanity.
Well,
I look forward to seeing
I look forward to getting you involved. Everywhere I go, I try to get people involved, and you can get more information at our website. You mentioned it earlier, bridgeforhealth.org. We also have a Facebook page and a Twitter. So it's Bridge 4, the number 4. Oh. Bridge for Health.
Okay.
That's our handle.
All right.
We would love to hear from you. And there's many different ways of participating, and I think that that's what we're really trying to do, is encourage people to participate in this process, because I don't own it. We own it together.
Right. Yeah. Thank you.
Okay.
Thanks so much, and I'll see you next time. Take care of yourselves.